Hi, I'm Sheila Reimer. In the year 2000, 189 of the world's leaders came together to make a promise to improve the lives of the world's poorest by the year 2015. It's called the Millennium Development Goals. End hunger and extreme poverty, universal education, gender equity, reduce child mortality, maternal health, combat HIV, AIDS, environmental sustainability. Yet, 10 years into the project, according to UNICEF, about 21 children under the age of 5 die every 3 seconds. Get it? They die from preventable causes brought on by extreme poverty. Living in Canada, one might never experience or truly understand how poverty is taking its toll on the youngest and most vulnerable in the world. Ending poverty. How are we helping? My name is Sheila Reimer, and I'll be speaking today on the Millennium Development Goals. Specifically, I have chosen to speak about the fourth goal, reduce child mortality. By the year 2015, the goal is to have reduced child mortality by 2/3, from 93 children of every 1,000 dying before the age of 5 in 1990 to 31 of every 1,000 by 2015. What are students at UCFE and all over Canada doing to help support and achieve these goals? We are now 10 years into the campaign and are 32% of the way towards achieving our goal of reducing child mortality. Sadly, 8.8 million children still die before they turn 5 years old every year. Thankfully, there is hope to confront these jarring statistics about maternal and child deaths. Inexpensive, cost-effective, proven interventions have had and continue to have tremendous impact. Since 1990, the global under 5 mortality rate has been cut in half. We know it works when it comes to saving children and also their mothers. According to UNICEF, 70%, most child deaths, 70% in developing countries, result from one of the preventable causes: acute respiratory infections, diarrhea, measles, malaria, and malnutrition. What are Canadian students doing to help? Well, Rick Mercer's Spread the Net campaign, Student Challenge, is one campaign that has involved students from all over Canada to help make a huge impact in the prevention of malaria in children and their mothers. The goal is to raise funds to purchase insecticide-treated bed nets for Liberia and Rwanda. The challenge was founded by Belinda Stronach and Rick Mercer and is in partnership with UNICEF. They started this campaign in the year 2005. In the 2009-10 campaign, Rick Mercer pitted the West against the East, and over 129 high schools and 29 colleges and university campuses participated. The West came out on top, with Simon Fraser University students raising over $16,000, and in the East, the University of Ottawa raised $5,000 for the challenge. In the last 3 years, students have raised over $795,000, contributing enough for nearly 80,000 bed nets, and according to spreadthenet.org, because entire families of up to 5 people can sleep under one net. This represents 400,000 people being protected from the biting mosquitoes thanks to Canadian students. What about UFE students? What are we doing? Well, to start with, our students have formed the International Development Student Club, and this student club wants to raise awareness of and foster interest in development issues. It raises funds for international outreach, which provides opportunities for our students to attend conferences, events and participate in overseas projects, as well as creating relationships with the international community. The work is conducted through active collaboration with local and overseas organizations and facilitates interdisciplinary communication between students and faculty at UFE. Secondly, UFE houses the Global Development Institute. Within the context of the MDGs, that's the Millennium Development Goals, the Institute focuses on children and development, as well as good governance and the rule of law, environmental sustainability, and education. For example, under the GDI, a comprehensive plan was developed to improve the accessibility to clean drinking water in a small town called Uganda, Africa. The goal was to provide clean, safe drinking water within a reasonable distance and at an affordable cost. The project included extending the water supply to a new medical clinic and the school district, thereby reducing disease and infant mortality, improving the socioeconomic status of the community, and supporting our goal to reduce child mortality. And there's a picture of the actual health center right there. The GDI is working on an exciting new project that they are proposing. It would bring youth in both developing and developed countries together to help achieve the fourth goal of reducing child mortality and achieving universal education. The project, which is called Development for a New Generation, proposes to link UFE student interns with students from 20 local secondary schools, and through social networking, website, video conferencing, connect with other youth in developing countries. Youth working with youth to collaborate on projects and information share. What a great way to support and achieve the two goals of reducing child mortality and access to primary education. In conclusion, you can make a difference. I know that the problems may seem really complex, and we often feel that we're so far removed that we can't help. But the truth is, we can. You don't have to look far. I did a little bit of digging, and I was able to find a number of projects that I could have helped on. Help end poverty. You make a difference. Find out what it takes. After all, this is a global problem that needs people like you from the Fraser Valley to implement the solution. Let's meet our target and reduce extreme poverty by half in the year 2015. Make a difference. Thank you.